Bayern star footballer Jamal Musiala suffered a serious left leg injury on this play earlier today at the Club World Cup, and in this video we'll take a look at the injury mechanism, talk about what I think happened here, and the implications it could have on his career going forward. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. So we don't typically cover a lot of football, of course, lots of American football, but let's dive into this injury here. And what I first want you to focus on is just the position of the limb and the joints as you go into the injury moment itself, because the forces that are applied to the joints, the ligaments, the muscles, tendons, depending on the position of those joints, is going to influence what structures are torn and what structures fail. In this situation, of course, Musiala is going out here. He's leading with that left ankle. And as he goes down, he plants that left ankle rigid into the turf. This is going to cause that foot and ankle to be stuck and rigid so that any force coming upon the leg from the outside or the top, there's not going to be any ability of that ankle to move or to play or to just twist to the side because of all that locked position, specifically with him being dorsiflexed. So going on to another couple of frames here, as he advances forward, that tibia is going to go forward over his foot, and that's going to bring his ankle into a dorsiflex position, meaning the toes are pulled up towards the ankle. What that does is it engages the ankle mortise with the talus between the tibia and the fibula in a locked position to where there's very minimal side-to-side play in the ankle. As the keeper then comes into the side, that forces his leg into this valgus load. It's going to be bent inwards. That's going to externally rotate the foot. That's going to cause that tibia and fibula to want to split apart. And the cascade of events that take place thereafter from the excess external load, I'm concerned would have dislocated and fractured his ankle as the most likely scenario. Here in this view in particular, we see his right leg right there, and his left foot in this position is trapped. His left foot is locked into the ground, but that force is coming in from the tibia, causing that ankle to evert and the foot externally rotate, concerning for dislocation, fracture. Next, we'll look at our biodigital anatomy model and understand exactly what anatomy and structures are involved here and the career implications on this injury. But first, I want to take a minute to give a shout out to the sponsor of today's video. This video is sponsored by one of my absolute favorite brands, Ancllar. Ancllar makes performance dress wear for men. And if you're not aware of them yet, well, you've seen me wearing their dress shirts in pretty much every video I've made for the past few years. Hands down, they're the most comfortable dress shirts I've ever worn, and they're perfect for these hot summer months. I love the material. It's this really nice athletic wear, sort of stretchy, lightweight fabric that's very wrinkle resistant and also stain repellent. I don't have to worry about wrinkles after they come out of the wash. I can simply hang them up to dry and never have to iron a thing. So if you're tired of uncomfortable dress shirts, then head over to ancllar.com and use my code Dr10 to get 10% off your purchase. While you're there, check out their other great lineup of everything like polo shirts, short sleeve shirts, ties, pants, socks, and even shoes. Everything you need to fill out your wardrobe with some of the most comfortable dress wear you've ever tried. Their shirts are also really durable, which is a nice point. Now that I've been wearing them for so many years, I've seen just how well they hold up over time and don't lose any of those great characteristics that make them my favorite dress wear. So if you want to step up your wardrobe game with some affordable, fantastic quality dress wear, then check out Ancllar today. Again, promo code Dr10 to get 10% off your purchase. Thanks again to Ancllar for sponsoring today's video, and let's get back to our learning. So when we look straight on at a left ankle here, we're going to have the tibia, the shin bone, and then the fibula, which is going to be that bone, the bump on the outside of your ankle. That's called the lateral malleolus. That's right down here. That's what you feel if you rub the outside of your ankle. The ankle mortise is then going to be this part of the ankle joint. So that's going to be where the tibia and the fibula come together around the talus. The talus is kind of that main bone in the foot making up the ankle joint, and then the tibia and the fibula rotate back and forth on top of it, kind of like a hinge joint. If you look on the inside of the ankle, we're going to see the deltoid ligament complex. That's the ligament complex injured when you have an eversion sprain, meaning the ankle goes that direction. And if we rotate through to the outside, we're going to have the typical ligaments that are injured with a traditional low ankle sprain. We'll hide some of these tendon sheaths, and then we're going to see those three ligaments: the ATFL, anterior talofibular ligament, the CFL, the calcaneofibular ligament, and then the PTFL on the backside. Your high ankle ligament, or the syndesmosis, is extremely important. It runs here between the tibia and the fibula, and it helps to maintain that integrity, that stability of keeping that ankle mortise nice and intact. Whenever you get a high ankle sprain, typically what occurs is the ankle is dorsiflexed, meaning it's kind of brought up towards the foot, it's locked, and then the load of force comes in this direction, which as the foot then externally rotates, it makes that fibula and tibia want to pry apart from one another. That prying apart from one another stresses this high ankle ligament complex, and then if it's a high enough external force, a high enough external load coming in, you begin this cascade of forces and injury through the ankle that ultimately can lead to a fracture, failure of these structures, and then sometimes the ankle itself dislocating. Now, when we talk about these injuries, right, you could have just an isolated fracture higher up in the tibia fibula. You can also have it involved down lower where the fibula, the tibia are injured down here, and you get an actual dislocation and a break of the joint. So it's hard to know from just the replay if we're talking about just an injury to the tibial shaft higher up or if we're dealing with more the ankle joint, but I would be concerned that we're dealing more of with the ankle joint itself. So now if you keep all that anatomy in mind and you think of that position where you've got your talus bone right here, you've got your tibia and your fibula anchored around the talus, making up the ankle joint. When you dorsiflect, you engage that ankle more as you lock it in place. So that load is going to come in from the outside. It's going to cause eversion, external rotation of that ankle. And in some cases, right, it depends on exactly where the force comes through, whether this is going to be just a fracture dislocation. But based on what we saw when he kind of rolled over to the side, I would ultimately be worried about fracture dislocation. If in a position like this, the foot is not completely anchored on the ground, then what will happen is the leg will just get swung over. You're going to get caught up. You might twist your knee. But when that ankle gets planted and fixed into the ground, there's nowhere for that force to dissipate through. And all that energy is going to get transferred through the bone, through the joint, causing the ligaments to fail. And then subsequently, the bony anatomy that's going to constrain the joint further, leading to the fracture. On-field management for something like this, the first step is going to be to reduce the fracture, reduce the dislocation, try to maintain, restore that initial integrity of the alignment of the bones and of the joint itself. The other thing we can't see when these players are wearing socks is whether this was an open injury or a closed injury. An open injury means the bone broke through the skin. You're going to have a much higher risk of infection, increases that level of severity and potential complication, versus if the skin integrity is maintained, that's a closed fracture. Another term for an open fracture is a compound fracture. After everything is nice and stabilized, they're going to get them off for imaging, x-rays, evaluate all those structures, get the joint back in place if it needs to be done, and then you're going to treat the fracture, the dislocation. You're going to do surgery to get everything back in proper position and stabilized, and then obviously rehab. This is something that I would anticipate is going to have an impact on his upcoming club season for Bayern. The other concern about these is not so much career-threatening nature, but the career impact. Because what we see on the replay is the bone, we see the joint, but we don't see the ligaments, we don't see the tendon, we don't see the cartilage. And those other structures, damage to them is what going to have recurrent pain, recurrent swelling, difficulties with instability. It's relatively pretty easy to get the joint back in place, fix the bones. But what can be harder is those subtle changes to the underlying cartilage in the joint, the ligamentous structures. And when you're performing at that high level, that 100th percentile of athletic performance, those small little things to a critical joint like your ankle can have a huge impact on your speed, on your cutting ability. And so while no, I don't see anything like this at surface level being a career ender, absolutely has the potential to be career altering because of the level that these guys operate and the difficulty to restore all that tissue integrity in a good enough way where they get back to 100%. Of course, nothing that says he can't, but when we see something this significant, you always have to be prepared that this could be career altering, not so much career ending. Hopefully it's not an open fracture. Hopefully the fracture amount is minimal. You can get a simple dislocation of your ankle where you don't fracture anything. That's obviously a better case scenario. So we'll see here, but from what we've seen at face value, would expect serious implications for his upcoming club season into the fall, and then potentially career altering. That's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.